Hi, I'm Bob Baravarian from University Foot and Ankle Institute in Los Angeles, and I wanted to talk to you about our minimally invasive Achilles repair technique. So the Achilles tendon is the strongest and largest tendon in the body, and unfortunately it's a very commonly torn tendon. No one understands why a person tears their tendon, but it seems to be somewhat related to age, maybe lack of activity, and then a level of activity that's out of the norm. But patients usually feel a pop, they feel like someone kicked them, or they feel a snap behind their foot. Often there isn't much pain because once the tendon completely tears, there's really no significant pain. And patients sometimes will walk around on it for a week or two but feel like their foot feels weak. Often the tendon can easily be diagnosed as torn, and it's often just done with exam. We use both ultrasound and MRI in our offices in order to diagnose a torn Achilles, and our repair system is done through approximately a 1 to 2 centimeter incision. The idea behind using the minimally invasive technique is not necessarily the size of the incision, which is about this big, but more because when the tendon tears, you have kind of loose spaghetti ends in the area which is normally sewed together. And so this causes a very weak repair unless you make an incision that is really big, and then you have a problem with scar tissue formation and putting the tendon and soft tissue back together. Our technique is to pass the stitches not through the torn area but into the good area, and those stitches are then pulled down and pulled up, and so you bring the two ends of tendon together, but you're grabbing the solid good area through a minimally invasive technique. The surgery is done outpatient. Patients are usually home an hour after surgery in a surgery center, and they usually are in physical therapy within 4 weeks and back to activity and sports within 3 months. The most important thing to realize with an Achilles tendon repair is whether it's done through a minimally invasive technique or through an open technique, if you rush too much back to weight bearing and into physical therapy too quickly, which is something all patients want to do, you don't allow the ends of tendon to really become structured and solid. And a stretched out tendon after surgery is just as bad as a torn tendon that isn't repaired. So we hope to see you if you have a torn Achilles, and we hope you don't tear your Achilles, and look at the minimally invasive technique because it's amazing.